what do we know about cars and physical activity and obesity? This one just quickly shows you the quartile of vehicle miles traveled by the percent obese, and the highest quartile for vehicle miles traveled is associated with the highest obesity rates. We essentially increase our obesity risk per hour in a car by 6%. And we're seeing more and more studies published in medical journals, public health journals, showing this linkage. Most recently, last October, an association across countries and cities that showed that those areas that have higher rates of transit, walking, and bicycling have commensurate lower rates of obesity and diabetes. Transit, too, is clearly associated with increased physical activity. It's recommended that we all get 150 minutes a week of physical activity, about 30 minutes a week, 5 times, and that can be just walking, of course, and you're already reducing your risks for heart disease, diabetes, and stroke. So transit can be the solution for incorporating physical activity into daily activities. A third of public transit users are achieving these recommended 30 minutes of daily physical activity by walking and to and from their transit. Charlotte, North Carolina actually took it one step further and looked at body mass index, which is a true measure of obesity, and found that when they put in the light rail transit, subsequent to that, there was a reduction in BMI in their citizens. This is a pretty busy slide. It's a consensus table about active transportation as a solution to our obesity epidemic. And the three main columns are the endorsements of the Centers for Disease Control, the CDC, the Institute of Medicine, IOM, and the Robert Wood Johnson Foundation for 6 best practices for communities to be focusing on, creating bicycle support, walking support, school siting issues so that they might be more centralized so that children can walk and bike to school, public transit, traffic safety, and access to parks and other facilities. These are evidence-based interventions that if we could promote, we would have a healthier and more vibrant society. So if I might turn now to air quality quickly, if you should know that asthma has been going up over the last 25 years, and it's directly linked to the air quality that we all live in. Currently, about 9% of children in Colorado and just under 7% of adults in Colorado suffer from asthma. Of those children, 1 in 5 of them came to the emergency room last year or an urgent care center for an asthma exacerbation. And so, again, there's this health disparities component to this aspect of health, where black children have higher rates of asthma than whites or Hispanic. And if you're below the poverty level, you have higher rates of asthma as well. So recognize, all of you as public health specialists, your work isn't only just improving the health of populations, but you're also focusing on reducing health disparities, which is a real issue in our country. An interesting fact that during the 1996 Atlanta Olympics, if you might remember, people were encouraged not to drive their cars. There was a substantial reduction in peak ozone concentrations during the games, 18%, and during that time there was a 42% drop in asthma emergency room visits as well. We spend nationally almost $20 billion a year on asthma, so again, it's costing us a lot of money. In our state, it's probably $60 million a year to take care of people with asthma. Finally, on safety, it's something I speak about with my families every day. If you're a child between the ages of 2 and 18, your #1 cause of death are motor vehicle accidents. And this table here just shows the #1 rank of cause of death for various age groups, and all those red boxes at the top across the age groups is going from 4 to age 34, I believe, are due to motor vehicle accidents. So if we can work on reducing traffic and finding alternative solutions, it can be an impactful on our number of safety and injuries and deaths. Motor vehicles are responsible for 1 of every 5 deaths in children ages 1 to 14, and they're more common if you're in an area of high traffic volume, lower income, and younger age. This graph shows you that communities that are promoting smart growth have substantially lower injury rates from car injuries than those that have more common sprawl. Again, the costs are substantial for our country. In 2000, motor vehicle crashes cost $230 billion in medical costs, property damages, and lost productivity. So again, coming back around to my work, I'll be seeing patients today, and I also do work that's focused on improving the health of our communities. And so when you see these slides, they're not just about taglines, but they're really about a commitment that we have to work with you all and work with other partners in the community to think about the kinds of places we build so that we can reduce obesity, increase physical activity, impact asthma, and safety. And we do this through a multi-pronged approach where we partner with Live Well Colorado communities. We partner at the regional levels, at the state levels, and the national level. And we think that when we do this, we end up identifying barriers at each of those levels and work towards reducing those barriers and learn how to fix things. And that builds a certain momentum that we think is part of the solution to the challenges we face. So here's just a short list of some of the things that Kaiser Permanente is involved with through active transportation. At the local level, it's partnership and sponsorship of the Live Well Colorado, which is an obesity prevention initiative here in the state of Colorado. We're sponsors of the bike sharing program downtown. We were involved in sponsoring the Denver Living Streets initiative that's looking at how we redesign corridors in the Denver metro area. And then, of course, at the regional level, we're involved with Safe Routes to School programs, as well as at the federal level. And at the state, we've been involved with CDOT and a variety of legislative efforts to improve complete streets, as well as things like food access in schools. So my request today from you is for you all to recognize the seriousness of this issue and that you guys are a big part of the solution. We need to be able to build transportation systems that ensure access to healthy options. And I think this is an important phrase because it's not nanny government saying how one lives. It's providing options for whoever you are so that you can make choices and make easy choices to live a healthy life. And we have to do that by providing access to transit, making it easy for people to take short trips that leave the car behind, given that 40% of trips are for less than 2 miles. And we need to reduce the rate of vehicle miles traveled. So this last statement, I think, is my key message. Transportation planners will have more impact on the health of our citizens, reducing health disparities, making healthcare affordable, and creating thriving economies and communities than will the healthcare system. So I'm deputizing all of you as public health specialists, and I would challenge you to remember that in your day, and even be so bold as introduce yourselves as public health specialists as part of your titles, because the public health community is actually depending on this partnership with you if we're going to solve these issues. Here's a number of partners that you might be thinking about, and there's many of them already here in the room today, which is exciting. Live Well Colorado community coordinators and site coordinators are available, public health departments. The publichealthalliance.org website will give you lists of local public health departments for the state of Colorado. There's a number of nonprofits and local health professionals that would all be willing to help and support you in your efforts. We're always willing to come and speak on your behalf at citizen boards or at city council meetings, or whatever you think it might take to bring the message of health to the important work you all do as transportation planners. Thank you.